All right, good evening. Thank you everybody for joining us. I'm Dr. Kristen. This is Monarch Family Chiropractic's spinal workshop, Tuesday night on arthritis, and talking about healthy curves always relates to, is there arthritis, is there not, and why has that developed? So we're going to start jumping right into the components of what arthritis is, what we call it, why we call it that. But a really big factor is that there's a lot of statistics to talk about. There's a component of, arth means joint, and itis means usually swelling or inflammation. And so that's what we're looking at is the swelling of a joint and or multiple joints. So when we go to the doctor, say, and tell them, I have swollen or painful joints, then they usually proceed to tell us that they figured out what it is and that it's arthritis. A lot of times what happens is they've just charged you for what it is to tell you in a different language that you have painful or swollen joints. So how can we gain a better approach really moving forward as to how we address it? We kind of have to grow you into know what education comes behind what things are and what things in our medical world explain things as. And really it's like how to know if you have it, understanding what the different kinds are, I think is really key. And then knowing which kind you have. There's different stuff that's arthritic driven, and we'll cover a little bit of that. And then what to do about it. And if you don't have it, how to keep it that way, how to keep that arthritic inflammation of the joint away and at bay. So basically, people with arthritis need a few things. We need increased quality of life, really a proper assessment of the condition. Is this something that is structural related or not? Is it something of a different nature? And there's got to be on some type of an exercise program or movement program for the rest of our lives. We're designed to be in motion. When we lose that motion of the joint, if it gets subluxated, fixated, then it inflames and swells because it's moving in an improper way or things are doing different work than they're supposed to. So we need to have that movement for our lifetime, or again, we start to create an arthritic, a very degenerative joint based on the components that create that we just talked about. So there's components of millions of us in America are diagnosed with this, of different forms of some form of arthritis at a very high rate, meaning, Americans being told by doctors that they have some form of arthritis is 1 in 5. So that's, almost 25% of adults in our country. So that's a significant amount of people and a significant amount of discomfort people are in. They're projecting with the type of things we do, meaning in technology, things with a lot of poor posture and a lot of sedentary posture. If we're at desks, workstations, just immobile, that's what creates that arthritis. So they're saying that they're estimating we may have more in the range of 67 million over the next less than 10 years. And again, it's watching these younger generations and having this stuff show up sooner in life based on the movements or lack of movements we're doing. Now, when it's looking at osteoarthritis, again, movement of joints and arthritic areas within the joint and inflammation, they're expecting that to project even higher as well. And this is things through Journal of Arthritis and Rheumatoidism. So when CDC says that 1/3 of Americans are suffering from some form of arthritis, we need to be talking about that and getting to the bottom of that. Now, there are types of arthritis. Rheumatoid arthritis is more of a chronic inflammation condition that's more of an autoimmune disease, where the body's immune system is basically attacking its own tissue. So there's an increased joint pressure from that excess fluid, and that's due to that swelling. And then it's causing the skin over the joints to basically kind of turn or get that purplish, bluish hue. So that is different type of arthritis when we're talking about something in an autoimmune condition. So that affects things more like hands, feet, ankles, wrists, knees. The joint's going to get warm, tender, sometimes even swollen because of, again, that inflammation. Deformity of the joints results as that disease progresses. So when you see someone's fingers really almost at an angle, tilted, that's bent laterally, if you will, versus a straight motion like this, that is really how the joint results and progresses over time. It's very common and more common in women and females by almost 3-to-1 ratio. And it's usually in that age of onset between 20 and 40 years old. Now, in metabolic arthritis, there's notable presence of like soft tissue masses. So within in the infected tissues or affected tissues, excuse me, the margins where there's bone lesions and things are different, but the preservation of the joint space is good. It's different. So an osteoarthritis, which we work more with, the part of the joint of the bone where the things touch and rub in our spine and in our some of our extremity joints, those are where those spurs develop. So when we're looking at x-rays, which we'll do in a minute, it's developing into the holes kind of where the nerves exit. And so where those spurs are going, it's like bony projections of the body laying down more bone, putting bone in places it's not supposed to be, which then pushes against the nervous system, the nerves, the spinal cord, or the discs, things that are in and around that space that needs to stay open. And that's what's putting pressure upon the nerves and causing things like when our patients come in with numbing, tingling, a burning or a pain sensation in an upper extremity. So shoulder, arm, elbow into wrist, hands, where it innervates those nerves and leaves the neck and goes down to the extremities. That is where we're getting pressure upon those nerves because we're getting lost that space between where the nerves have to send their signal out and where the bone's not supposed to be. So that is more the osteoarthritis that we are addressing in our office. Let's see where my screen is going to go here. There we go. So really the burden of arthritis. There's a component that we're just going to start flipping through here because there's so much data around here and this topic. But I think we need to have a broadened understanding of how significant the issue and conversation is around a general outline of where our healthcare dollars are going. Really, sick care or crisis care dollars are spent in the U.S. So, roughly 3/4 of the trillions of dollars spent in the U.S. is on chronic illness. Arthritis is a chronic illness, something that develops over time and becomes that chronic component. And roughly 3/4 of chronic illnesses are musculoskeletal, which is why we're talking about this today. And a lot of, or I guess I would say that same percentage of about 3/4 of those musculoskeletal illnesses are spinal. And so all the more reason we're getting checked, we're getting adjusted, we're getting motion and mobility and function back into our structural nervous system and our spinal system, because that is what is going to decrease these costs to all of us in our nation, and create less burden like what you're seeing on the screen. It is an individual burden on quality of life. It changes things, physically, emotionally. That can change what's happening in your family. Direct costs in medical care, indirect costs in earnings, like what does that cost somebody the ability of what they cannot do or how they cannot work or how they cannot perform. Billions of dollars in this department. So it's a huge, huge burden on our country and on our healthcare system that it really isn't about health in a sense when it's just dealing with this very chronic illness instead of maybe more of a preventative way. So we want to look at having not the burden of being out of work, having a disability, having emotional, physical components there on our system that doesn't need to be, and obviously change what happens with just the burden it puts upon our household, the burden it puts upon our health and ourselves and our family and all that it impacts. So there is a graph that I'm going to pull up here. Traumas and stress trigger arthritis, and years of say doing an activity in a less optimal way, right? In less than perfect form jogging, high impact aerobics, high impact sports, fast sports. So things like football, soccer, basketball, contact sports with football, rugby, hockey, things like that. And other things that create that is even just the weight upon our frame. So these are kind of the circle of everything, if you will, fails in isolation. So stress or poor posture, or again, that additional weight, it creates damage into the joints. It creates muscle weaknesses over time. Then that's creating an immune reaction, right? A cascade of inflammation that changes our entire chemistry in our body. That creates that swelling and that ligament damage over time that we were just talking about in the types of arthritis, and that inflammation component, that's all the swelling. Then that leads to pain, right? Because the swelling, the fluid's taking up space within the joints and within the spaces it's not supposed to. So that creates a lot of discomfort and pain, and then ultimately decreased function. It also shows in a lot of research that we were just looking at that it's talking about there's conclusion about immobilization for whatever reason is one of the factors in musculoskeletal degeneration. The research is showing that beyond reasonable doubt that the immobilization is not only a cause of the osteoarthritis, but it's what's delaying the healing process. So the reference there is osteoarthritic changes and the loss in the joint mobility can be produced either by a single period of immobilization, so a few weeks time, say, versus repeated, short periods of time of immobilization, like several days each at a time. So let's switch kind of gears. And degeneration is not a result of necessarily wear and tear. It's the result of the abnormal biomechanical motions. So it's any structure can have that abnormal mechanical motion and have degeneration. Our bodies are designed, our structures are designed to last us over 100 years. So there's some interesting things when we talk about stressors on the system. We're looking at initial stressor. It's a change in that normal biomechanical pattern of a motion, a motor unit. A vertebral motor unit would be, for us, when it's not moving right, a subluxation, right? Improper or less than proper motion. If it's allowed to persist, this altered biomechanics, or subluxation, is going to change the pressure into the discs, the bones, producing load and stress upon the cartilage, the joints, and the bone. That change is a kind of a micro environment to the chondrocyte, which is a component of what I just described. And it's how that process of degeneration begins. So we used to believe that degeneration occurred as a result of a lot of wear and tear. However, that's not really what's true. What's showing is that the joint lubrication is so smooth that wear of the articular tissues can't occur. So the friction is low. So when it talks about this picture with whales and dolphins, it's showing, even those types of animals can suffer with osteoarthritis. It's proving that the wear and tear theory cannot be the cause because they're supported by water, right? The subluxation is really what's triggering that poor abnormal mechanical motion is what's triggering that arthritis. It's triggering that inflammation. So this is research that was done on cell biology and how to reverse that. So it's kind of a posture check-in right now. We're going to do a quick posture drill as we wrap up the components of some of these other slides. And it's right now, it's don't move, right? In the moment, I want to make sure that you're sitting properly. Your glutes are against the back of your chair. Your shoulders are back against the chair as well. Your head is over your shoulders. And now, if you're not in that position, get there. Okay, so you guys at home and us here in the office have all just reshifted our posture. And, if any of you had to move, then just understand that you were growing arthritic degeneration just by the way you were sitting. So all this stuff doesn't happen overnight. It is happening over multitude of thousands of movements we do throughout our lifetime. So it's now our job to kind of take that responsibility to healthy posture and healthy things and the issues affecting our nervous system. So breakdown in age. Is it a result of age? No. Joints are designed to be used, right? And if properly maintained, they really should last. In a lot of research and a lot of studies and a lot of imaging showing that it should be well after 100 years. So there's nothing normal about arthritis that somebody that's 20, 30, 40, 50, 60, or even 70. So it's a change in what's happened. So many studies compare the difference between osteoarthritic patients and in just the aging population. And there's many differences. So somebody who's osteoarthritic has remolding of all the tissues around the joint and in different areas of the joint without going in deep diving here, and with other changes on x-rays and things like inflammation. In an aging person, we're seeing that there's cartilage changes only, that the osteophytes only, but that there's not this excessive use, we still don't necessarily see inflammation. So that's very different for somebody that's osteoarthritic and someone who's just aging naturally. So that's very telling, and that age is not the factor. And when I say age is just a number, it really is. It's not the factor for the arthritic breakdown of our joints. So we've got a couple pictures in here that you may have seen when we do slides on our curves and how that natural healthy curve in the neck and the low back should be in this C-shaped position, right? So we should have a curve looking similarly to the one on the left, but the back of the spine needs to be at that solid white line drawn. Just like that second picture on the right-hand side is where a joint and a spine has been degenerated for years, decades, to look osteoarthritic like this, where you see that very white, let's see if I can make my mouse move, this very white, here we go, part on the back of the bone there, behind that white line, and the spine is very straight. It's the back of the spine right here, where it's white, should be following along this curved line. So when we lose this proper motion and mobility, those joints are rubbing and touching over thousands upon thousands upon thousands of movements. And so it's changing its shape. And where I don't have a kind of one to compare to, but the bone should be very boxy and square, kind of like this one right here, or this one right here at the bottom. And you can see how this one looks different. This one looks flatter like a pancake. That one's getting flatter like a pancake. It's forming these little bone spurs out here, right? That's those osteophytes. And it's forming extra bone back here. What it's doing is over time trying to join the one above and below to each other so that they cannot continue to straighten or fall forward of that curved line. So it's just an improper mobility movement over time that's created this degeneration and created this type of arthritis. We have lots of slides on what Americans are doing with this condition based on our medical world, and that we're using a lot of NSAIDs. So we're using a lot of things like ibuprofen, Motrin, Advil, Nuprin, naproxen, things that are drugs that are really not necessarily more effective than aspirin, but they're definitely more expensive, and there's a significantly more risk with side effects. And they're really just supposed to be used for short periods of time. So they're suppressing parts of our the prostaglandins that are related compounds involved in the production of inflammation and pain. So they've been associated with acceleration to osteoarthritis and increased joint destruction, breaking down the joint. So there's lots of other side effects to them that have nothing to do with why we're taking them. Like allergic reactions, it's easier to have to bleed, more bruising, more fluid retention, definitely a lot of kidney and liver damage because our bodies have to process all those chemicals day in and day out over months and years. So we're damaging those vital organs that process things for us. But one that's often not mentioned is it's showing that what we just mentioned earlier, that inhibition or ability for the cartilage to repair. So the body can't go into a healing phase when it's in this kind of inhibited state. So acceleration of cartilage destruction, or the breakdown of cartilage in the joint, is happening in many joints in the body when we are constantly higher dosing with something, which what an NSAID stands for is like that non-steroidal anti-inflammatory drug. So a lot of us take anti-inflammatory things. It reduces inflammation for short periods of time and feels better, but then it's a constant thing that we're taking in order to keep that inflammation down through the medication, but we're damaging the joints in doing so. So the key is that we need to be in a preventative state, right? So that we're not falling down this path of these first 7 slides. So we've got to address pain, inflammation, and the dysfunction. How do we do that? And optimize the cartilage and the joint health, right? Is keep the joints moving, decrease our body weight upon our structure, build muscle mass, right? That is all good for our bones and for our joints. And it's reducing, obviously, then the stress on those joints and cartilage surfaces. Now, there's lightweight exercise with light weights, bands, and hand weights that people can do that creates that strength and provides that good mobility and good joint support. It does not have to be major amounts of lifting. You know, at what expense are we covering up, and at what expense are we decreasing that factor of healing? Getting out of pain is everybody's goal, but it's a warning sign telling us something's not functioning properly. So how do we reduce that inflammation, protect the joints, and get more mobilization, which will then decrease your pain, right? And who's addressing those causes, and how are we supporting that onset of arthritis? So we're going to share with you here, but there's they're in office as well. And those of you online, if there's ones that we need to get to you, we can certainly pass them along when you're in the office. But it's great to take an inventory on your arthritis. It's great to take an inventory and questions of, do these apply to you? Does that possibly where you stand in an arthritic state, or where your body is at? Is there stiffness upon the entire skeleton? Does it feel less, mobile to move? So looking through these questionnaires, it's kind of talking about what kind of warning signs and signals has your body been giving you? And this may be something just to share with someone else, a loved one or someone else who hasn't been receiving chiropractic care, adjustments, getting checked, just to see where their body and their frame is at. Different things manifest here. So dysfunction for some people, besides things we talked about, stiffness, swelling, it can be things like loss of manual dexterity, loss of your grip strength, pain upon raising the arms over your head. So some people notice that more when they're getting ready, when they're taking a shower, washing their hair, right? So sometimes it's just in these daily activities we do that we find the challenges are showing up. Difficulty in changing positions, getting up and down from sitting, getting up and down from the bathroom seat, right? Putting on our shoes and socks, things like that. Now, we talked about the physical signs. We went over those. We just showed you some x-ray findings of what that looks like and how we can help you assess that in a way in which we can support you with. And blood tests are of value. If this is RA, if this is a different type of arthritis like we addressed, then really looking for your RA factor or uric acid in joints, that's inflammation or along metabolic types, right? Looking at uric acid is a kidney component. So wanting to know if those factors are there, that can show you where different inflammation and pain in the joints coming from. That's different. That's a different cause of those things. So again, seeing how much it affects now at a much younger age for people. We don't want to, I guess what I'm saying is we don't accept that arthritis is okay and that arthritis is just part of getting old. That is not true. So we're going to just wipe that right out of our memory bank. We're going to change that pattern and think about what it is we can do to support proper motion, mobility, and all those components that just support function, because function determines structure. And so we're going to end on some of these components. If we could control our environment to reduce traumas, falls, and accidents, not slouch or ever have bad posture. Reduce sitting or changing positions often, right? When we talk about what's the position or what's this movement to do, the next movement, right? To stay moving. Sleeping with only a cervical pillow or without a pillow. Some people just, what they're using is just not supporting them at all. Always putting you as top priority, right? You and your health, specifically the health of your spine and your nervous system. Nobody specializes in that more than we do. And so it's not taking our posture for granted. It's knowing now that you can do something about this, that there are different types of arthritis, that we're not accepting that as a part of getting older, and that it's not something we have to necessarily live with. Degeneration happens accumulatively. So if we are looking at things sooner than later, we can slow that process down. We can slow the degeneration down, which slows down any of that arthritic process from the osteoarthritis standpoint. And we can reverse that process. If any of you have done corrective care, the sooner we get after that, the sooner we can slow down that process and possibly reverse it depending on which stage of that arthritis you're in. So, we can't reverse it back to it not being there, but we can really slow it down. And for some people, put those curves back into the spine that aren't there and stop that degeneration from continuing. So remembering that having knowledge is power. And without implementing it leads to depression is what we say, right? Is if we're not doing anything about it, that leads to a very sad state. So in that, it's about taking action. It's about knowing what we can do now. How do we do it? Who can we support? We don't want to cling to what is old myths and things that are hopelessness, that there is facts out there for more of us to be able to change this process long before it takes over us. And there's a couple slides that I'll flip through here. This is a workshop that's coming up, but it's just prepping you for that. We have vital needs in our body, and we need to act before it's too late. And so it is important that we are nourished in our body. We can live without food for a period of time. Does anybody know how long that is? About? Yeah. Yeah, it's several weeks. It can be almost up to a month that people can go without food. 3-4 weeks easily. How long can you live without water? It's actually more than that. Yeah, it's more than like a week or two, like 2 weeks, which is unreal to think about. These are all vital needs. We need all of these things, but they're in a certain order. How long can we go without oxygen? Yeah, a couple minutes, and we start having damage and loss of brain function. How long can we go if we eliminated the impulse from your brain to your body? Yeah. 0. Right? Nerve system has to flow, which is where what the spinal cord delivers from your brain to every part, piece, cell, tissue, organ, muscle of your body. So without that nerve flow, in a sense, it doesn't matter. Our oxygen consumption, our water consumption, and our food. If someone is laying lifelessness, we don't go offer them a protein bar, right? We want to see, are they breathing? But the first thing we're not doing is shoving a water bottle in their throat. Are they getting nerve flow? Do they have a pulse? And then are they getting oxygen places, right? It's in this top-down order. So if taking pressure off of the system allows your body to function at its optimum, then that's the component we need to focus on to support the mobility, the functionality of our systems in our frame, in our musculoskeletal system, right? Without that, it's really irrelevant. So I hope that you gained some information about arthritis, gained a little bit more from maybe what you learned in some of the curve, healthy curve workshops, and preps you a little bit more for a great workshop on vital needs, which is this triangle right here. So we look forward to your takeaways. We have those arthritis inventory sheets in the office. You are welcome to message us if you're not in the office, in the location of the office, and you're tuning in tonight. But know that they are here for you to support you in assessing where you're at, where your loved ones are at, so we can support you guys in your most vital selves. Thank you for joining us tonight. Thank you for your patience in me starting late, and we look forward to seeing you next Tuesday. Goodbye for now.